I think we're going to go ahead and get started. So thank you so much for logging in for this. I'm really excited. I am mostly a fan of art therapy, but to be honest, didn't know much about it. So I pulled in Meg and Brittany, who I'll be handing off to in a second, to try and tell us a little bit more about it. Just to go over some of the ways in which you can interact. You will not be able to unmute yourself for this talk, at least until we get to the questions section. So right now, everyone is muted. If you need to get in touch with me or have a question, just either write a message in the chat box, or if you want to use the emojis or get my attention through either raising your hand or in the participant panel, go ahead and do that. So with that, I will go ahead and hand it off to Brittany.
Hi there, everyone. I'm so grateful for this togetherness. As a board-certified art therapist serving the VUMC system, I'm just so grateful that our community can come together and learn more about my Meg and I's profession that I feel so passionate about. I am so incredibly confident and privileged to have Meg Bierman speak on art therapy. Meg has her master's in art therapy from George Washington University. She is currently a provisional art therapist and licensed professional counselor, mental health service provider based in Nashville, Tennessee. Meg has over 6 years of experience and has practiced within a multitude of sites, including inpatient psych units, a trauma clinic, school-based sites, and most recently, she is working in her own private practice. And as a mental health provider, Meg uses her counseling license along and coupled with her art therapy training and brain spotting training to provide individualized therapy to her clientele. And it is such an honor and to introduce my colleague, Meg Bierman.
Awesome. Brittany, thank you so much. So I want to start this presentation just by thanking everyone for just reaching out to me and for welcoming me into your Vanderbilt community. I'm very mindful that this time right now is very stressful, very different for all healthcare providers, and I am just so grateful for you to bring me in and hopefully to use me as a source of support for all of you during this time. So I am here for all of you. And so I'm going to talk a little bit about art therapy today. So my name is Meg. I'm an art therapist in Nashville, Tennessee. And we'll go ahead and get started. So I do want to give a little bit of a caveat. The best way to learn about what is art therapy and what I do is definitely through showing lots of client artwork. And of course, the nature of what I do, especially working in trauma, some of the images that I'm going to show for some people can feel a little bit a sense of discomfort and maybe even triggered. So I definitely want you to feel free to take a break at any point if you need to, step away. We are recording this, so you can always come back to the presentation, but I just want to let you know that there are some images in here that some people might find a little bit discomforting. So I just want to put that out there. So I'm going to start with a little bit about the definition of art therapy and what art therapy is. So art therapy is a mental health profession where clients facilitated by an art therapist use different types of art media, the creative process, and the artwork that they make to explore feelings, reconcile emotional conflicts, foster self-awareness, manage behaviors and addictions, develop social skills, and improve reality orientation, reduce anxiety, and increase self-esteem. So essentially, art therapy is just like regular psychotherapy. All the goals are the same, but a little bit different in that we're going to be using art therapy in the creative process as a tool for processing feelings and emotions and experiences. So as an art therapist, there's definitely a lot of training that's involved. I'm a clinically trained mental health therapist. And what that looks like is undergraduate coursework in both studio art and psychology, followed by a 2-year master's program, and then 3,000 postmaster's hours in the field, along with 150 supervision hours. That process usually takes about 5 years. And as Brittany mentioned, I've been practicing for about About 6. The art therapy registration board certification is a nationally recognized license, but it is state by state. And in the state of Tennessee, I do have my licensed professional counseling, mental health service provider credential as a way to practice while also having my art therapy registration. Where can you find art therapists? Where do we work? So we work in hospitals, schools, veteran clinics, private practices, psychiatric facilities, correctional facilities, substance abuse and rehab centers, crisis centers, senior centers, palliative care, and end of life. So essentially anywhere where you might find a regular psychotherapist, we would also be working with them as well. So most importantly, I say I am just a regular old psychotherapist, but I am clinically trained to use the art making process as a tool within psychotherapy treatment, only when it is helpful and appropriate for my clients. Typically, when I have a caseload, I'd say about 30% of my clients really respond well to art therapy, especially being an art therapist in Nashville, which is a super creative city, music city. I work with lots of creative individuals who often seek me out because they want to try art therapy. But for a large majority of my clients, it is just regular verbal psychotherapy. So I'm going to talk a little bit about 2 ways that we kind of use art therapy. So one is what we call art as therapy, and that is going to be using art therapy to kind of just focus on the universal idea that creating art, when we make art, it evokes joy, it creates calm and relaxation, connection to others, especially in a group setting, and can be a really positive distraction. Art as therapy does not require any psychotherapy or emotional processing. That's not really the goal. It's really just to engage in art with an art therapist and have them kind of guide you through the therapeutic process of making art. Usually art as therapy is used for kind of a drop-in or like an open group setting, maybe with children who kind of have a hard time verbally processing, so just creating is really helpful for them. Elderly, especially the dementia population, and also in a rehabilitation setting, so people who are using art making as a tool for refining motor skills or any kind of rehabilitation. Then there is artist psychotherapy, which is what I use 100% of the time in my private practice. And artist psychotherapy is going to focus on both the process of making and creating art and the product itself that is made. So many people ask kind of, what is art therapy in terms of a clinical treatment model? Is it psychodynamic? Is it DBT? Is it CBT? And art therapy is essentially an integrative form of psychotherapy treatment, meaning we can adjust and use art therapy to fit all different types of treatment models. So for example, I tend to lean more psychodynamic in theoretical orientation. So what that might look like with art therapy is asking a client to draw their fearful younger self or draw their adult self, comforting their younger self. So basically using art therapy as a very dynamic and malleable tool to fit into different types of theoretical orientations. So what is a typical art therapy session? Like, what does that look like? So what we use are 2 kind of types of art making. One is going to be structured interventions. We call them art therapy interventions. And these are pre-planned, guidelined themes that typically involve a prompt. And we pre-select the materials for a client or the group to use. Usually structured interventions are great for large groups. And then what we also use is spontaneous making or client-led art therapy. And that's very different. That's when the client chooses all the facets of the different art materials that they might want to use. And then it's often used, usually spontaneous making is used more within an individual setting. And I'm going to give you an example of both. So great example of a structured intervention might be offering I go ahead and make a drawn out piece of paper with a circle in the middle. This is what I use often for check-ins with groups or even with individual clients. So I'll go ahead and set out all the different types of art materials on the table. So I'll go ahead and set out markers, colored pencils, crayons, maybe markers. And give a prompt. So I'll say, using all the art materials on the table, I want you to draw how you're feeling today in this moment, in this group, using shape, line, color, symbol, text, and metaphor. You can work inside the circle. You can work outside the circle. You can flip it over if you don't want to use a circle at all and you just want a blank piece of paper. So offering lots of choice. And that would be an example of a structured art therapy intervention that I might give a group or a client. This is an example of one client that same prompt and kind of what that looked like for them. So they turned their paper vertical, and this client wanted to sort of think about the circle as a keyhole. And if he were to kind of push his eye and look real close into the keyhole, what might he see? And he saw this kind of image of this really scary monster. Here's an example of client-led or spontaneous art making. So this was a client that I was working with in his mid-30s, processing the death of his mother. The focus of our treatment was grief. We kind of started the session talking about the last moments that he spent with his mother, and we decided that it might be an interesting idea to have him draw what that looked like. And so he chose paper and pencil, which was what he felt most comfortable with, and drew the image of him with his mother, kind of the last few minutes of his life. So there was no kind of prompt for this. We did come up together with what we did want to create, but he chose the art materials and he kind of just spontaneously created this in the moment. So very different than as compared to kind of a structured art therapy intervention. A few common misconceptions from clients. So I like to talk a lot about these. So one that I get a lot from clients is, I'm not a good artist, I don't make art, I can't draw. So most importantly, you do not have to be a good artist or even really like art necessarily to engage in art therapy. The only thing that art therapy requires is an open mind, which we sometimes underestimate, right? Like how often it can be quite hard to do something out of our comfort zone or something very different or that we're not good at or used to. And then I also like to challenge clients in saying, when we are born out of the womb, we do not enter the world speaking a fluent language, right? Like fluent English or Chinese or Spanish. We all kind of get our needs met when we're hungry, we cry, when we roll around on the floor and experience our life in a very sensory way. We all survive, right? We're all here. So we have all been able to self-express at some point in our life without using words. And so we've all done it before. So art therapy is just kind of encouraging you to get back to that place of how can I come up with alternative ways for self-expression without having to rely on words. Two is I like to draw in my adult coloring book and do art therapy on myself. So most importantly, great rule of thumb is it is only art therapy when a licensed art therapist is present. So it's not possible to do art therapy on ourselves. I do want to talk for a second about adult coloring books, which have been very popular in the last 5 or 6 years, which is awesome. And I think any art therapist would say that the fact that there's kind of a boom in these really awesome mandala and adult coloring books really must speak to the need for art being a great tool for people who want to de-stress or to use art to self-explore. However, a lot of the coloring books that we see use the term art therapy or label them art therapy for the coloring books. And it's really important to remember that that's not art therapy, right? So one, being mindful that what makes art therapy is definitely the relationship that we have to our client. And so as you can see, a coloring book in and of itself isn't going to challenge you to make the changes you need to enhance your quality of life, wellness, and health. And that's what the real process of art therapy is about. And going back for a second, so lastly, are you going to tell me what I'm feeling and thinking just by looking at my artwork? So I also like to say that we are not Miss Cleo. We do not look at clients' artwork and say, well, this means this and that means that. We like to use the artwork as a tool to be curious and to kind of challenge our clients and to ask them about different parts of the artwork to kind of enrich their therapeutic process. So the artwork is not for us to interpret. A common misconception too that we get from actual therapists is, I'm an artist in my free time, I understand how to use art materials, I can do art therapy with my clients. Also not true. So it's really important to know too that as an art therapist, we are specially trained in the knowledge of art materials paired with diagnosis and mental health history. Now what this means is we know how to manage very fluid art materials and also very restrictive art materials and know which art materials to use based on our clients' therapeutic goals and their mental health history. So for example, if I'm working with a client who is processing grief, I tend to use more fluid materials like watercolor, oil pastel, things that can be blended, because often the grief process, when we think about grief and fluidity and water, those pair very well together. If I'm working with a client who's experienced any kind of sexual trauma, I definitely want to stay away from materials like wet clay or more water or fluid materials and stick to more restrictive materials like marker, pencil, found materials, 3D objects. Because what we can see is when we aren't mindful of the correct materials to use with our clients, they can experience regression, dissociation, and even dysregulation. Something that comes up often is, for example, my client drew a picture of someone jumping off of a bridge. They must be suicidal. So it's really important to be mindful that artwork, our client's artwork, holds a time, place, and an explanation as defined by our client. It is not our own interpretation as art therapists. What something means for our client today might be different than what it means tomorrow, and even different than what it means 10 minutes after they make it. And it's really important for us to honor that. What we want to do as art therapists is definitely be curious about the artwork and use it as a tool to enrich our understanding of how a client might feel, free of judgment and shame, but always attuned to safety. So a great example of this would be a painting that was made by a client of mine in a group setting. And this was an adult inpatient rehab center for drugs and alcohol. Now, for this patient, it felt comfortable for her to draw herself using drugs rather than actually going out into the world and doing it in real life. It's not the first client that I've had. I've worked with suicidal clients where it feels comfortable to draw engaging in self-harm rather than actually doing it in real life. And as an art therapist, for us, that's a very safe and healthy way to self-express. So we definitely want to encourage that. Navigating the space as an art therapist can be pretty complex. For example, this was made in a group setting. So I did want to honor her process, but also be mindful that there are other people in the group as well who could see this imagery, and it may have been triggering for them and wanting to keep them safe. So how I sort of managed this artwork in the moment was asking the client if she felt comfortable keeping it in. I just kind of took a piece of construction paper and folded it in half, creating like a container or a folder for her. So, obviously feeling really proud of her for safely using self-expression and art as a tool for that, but also being mindful that we want to take other people's experiences into consideration as well. And she was happy to keep it kind of safe in a folder for when she left the group. So how do we handle artwork? So we consider artwork an extension of the self in art therapy. So I have all clients sign an authorization to release their artwork for me to keep it safe, essentially, in my office. So signature of the client is required. And again, artwork is considered an extension of the self. So if I am processing a piece of artwork with the client and I want to move it in a certain way or touch it, I will ask permission to touch it. Also, always names or identifiers are removed from the artwork if they're put in a presentation for educational purposes or research or publication. And then all artwork is stored safely for up to 2 years after we terminate with the client. I wanted to give you just a little bit of an idea of what a typical art therapist space might look like. This is my office, so I kind of divided it in half. On the left side, you'll see is kind of a typical talk therapy space, so a couch and a chair. And then on the right side, you can see there's a big space for lots of art materials. So I kind of divide up the room half and half. So benefits of art therapy. One is that we get this beautiful, tangible, visual portfolio of our client's progress throughout treatment. So what's really awesome is that once we terminate with the client, or really at any point, we can pull out the artwork and kind of arrange it in a linear fashion to see a visual, tangible kind of shift and change in our client based on the artwork that they've been creating, working towards their therapeutic goals. Art making also promotes self-esteem building through the creation and the completion of a task, right? So when we think about improving self-esteem, starting and finishing something or creating something is really good for that. Art making promotes choice and empowerment, especially the clients that I work with who have experienced trauma, which is incredibly disempowering. Clients are a very active part of treatment. We give them a blank canvas, but they get to choose the art materials and what they want to create. So it's an incredibly empowering process. And most importantly, art making is a very safe way for our clients to use imagination, right? So they can safely explore a world beyond their anxieties, their worries, their fears, their depression, or their current situation. I want to talk a little bit about trauma and art therapy specifically, because that's the kind of work that I do. And in order to do that, I want to kind of set the setting for kind of even what trauma might be and why art therapy and trauma pair so well together. So what is trauma? Trauma is when someone experiences something so chaotic, something so different, something so difficult, painful. Typically, it's when we're in survival mode, right? Just trying to survive, that our body, in an effort to protect ourselves, which I think is pretty beautiful, enters into something that we call dissociation. Now, dissociation is when different parts of our brain, I say, become unlit or go offline, meaning all the different parts of our brain are there, but they aren't, some of them become unlit and our brain isn't operating as it normally would if we were not experiencing trauma. So for example, this moment that I'm creating with all of you, it is not traumatic memory. I am calm, I am relaxed. So this memory is being encoded in my brain very systematically. And if someone were to ask me after the presentation, hey Meg, how did it go? I could easily draw out this memory and say, it was great, first this happened, then I talked about that and this. It would be very linear and very easy for me to draw out. When we experience trauma, different parts of our brain become unlit. And one of the places that we know becomes unlit is the Broca's area of our brain, which is the top left portion, and that is connected to speech and language. So because that part of our brain is unlit during trauma, when clients go to process their thoughts and feelings and emotions and to verbally express how the trauma has affected them, it can be very difficult for them to come up with the words to actually express what happened. So what they might notice is they might get a real tightness in their throat or in their chest, their face turns really red, and it's very, very difficult for them to kind of process and talk about what happened. Well, that makes sense because the part of their brain, which was speech and language, was not functioning properly. So the expectation is not for them to be able to have the words to describe it. In that sense, traumatic memory is stored very differently. Traumatic memory is stored as fragments and bits and parts and pieces, almost if you had a mirror and took a bat and just smashed it. So it's cracks and bits and pieces and parts. Memory is not linear in trauma. Time acts very differently. It's hard for us to remember what part came first or how long something lasted or even how many times something happened. But our physical body was present to the entire traumatic event the entire time, even though our brain was shut down, causing us to dissociate and not fully remember what happened. So typically our brain and our body work together, meaning if you are watching a sad movie, your brain says this is terribly sad and you start crying, right? So they work in sync with one another. But when we experience trauma, our brain doesn't remember, but our physical body does. So what we want to do with art therapy is integrate the brain and the body back together by using the process of bilateral stimulation. So if you think about it, left side is logic, verbal, words, concrete concepts, math, numbers, all the things that I'm personally not great at. Right side of our brain are emotions, feelings, elusivity, intuition, creativity, sensory, and memory. So when we engage in the process of art therapy, where we are using art as a tool to create, using our body and our hands to interact with the materials, while also verbally processing, we are using both right side and left side for full bilateral stimulation in order to process trauma. I was wondering if I could get a volunteer. Kendra, is that possible?
I'm not very good at unmuting myself. So if somebody wants to try and either raise their hand or type in the chat box.
Yes, it'll only be a minute, and if this is a no-fail task, it's like a very easy thing to do. Anyone can do it.
Navia, do you? Yeah, you. Okay, I'll grab you. All right, here you go.
Hi.
Wonderful. Is it Navia?
Yes.
Hi, Navia. Excellent. Okay, Navia. So if you feel comfortable for me, I'd like you to close your eyes, and I want you to choose your favorite holiday and draw out that memory for us. I want you to close your eyes and tell us, give us that full sensory experience. What do you see? What do you feel? What do you hear? What do you touch? What do you eat?
So, I'm walking down the road by my dorm at Vanderbilt, and I can see leaves falling and people out on the lawn, like picnics going on, talking. It smells woodsy.
Wonderful.
And there's like pumpkins all around, people decorated and carved, and yeah.
Beautiful. Excellent. Thank you so much, Navia. I'm giving you a virtual high five right now. I know you
Thank you.
So Navia, question for you. I could be wrong, but I am guessing that when you have your eyes closed and you sort of describe pumpkin and woodsy and people and the quad and curious if the actual word pumpkin or the actual word fall or the actual word quad flashed before your eyes.
No, I sort of just saw the picture and I kind of just used my words to describe it, as like an afterthought.
Yes, excellent, Navia. So Navia is giving us proof that memory is sensory, right? Like memory are not these concrete words that flash before our eyes. They are fully sensory. Memory is, what did I hear? What did I taste? What did I smell? What did I see? Who was with me? What did I feel? Right? So that's just a great example of when we think about memory and we think about processing memory, especially traumatic memory, it's super important to engage in a process that evokes all of our senses rather than just focusing on the words. Awesome. Thank you so much, Navia. Excellent. Okay, so art therapy and trauma. These are just kind of some bullet points in terms of why art therapy and trauma pair so well together, which I kind of talked about as I kind of spoke to trauma. And I really want to get into the artwork, so I'm going to move on just a little bit. Excellent. Okay, so I'm going to tell you about a couple individual trauma clients that I have, and then I'm going to segue into a bunch of different art therapy directives and talk about the artwork. So first trauma case that I'm going to talk to you about is a 22-year-old Caucasian female who I worked with for 3 months. She was seeking treatment for PTSD, substance use, depression, and grief. She had a history of a recent abusive relationship where she actually broke her jaw, and she had a childhood history of physical abuse by her father. There's also a grief component. Her father was declining from a chronic pain disease and also losing his memory, so he actually didn't remember a lot of the physical abuse that my client did remember. She was an artist. She was a set designer for a theater company, so she definitely came into art therapy really excited about using art as a tool for processing. The first thing that she decided to make was a mask. She took a mask and glued it to a piece of, why am I losing the word? She glued it to a canvas. So she worked very three-dimensionally, which I wasn't surprised by since she was a theater, created these set designs that were very much three-dimensional. And so the mask itself was all the black and white paint spoke to the bruising of the physically abusive and verbally emotionally abusive relationship. The blood on the face spoke to her breaking her jaw. And she took this large piece of fabric and sort of curved it around her mouth, covering her mouth and kind of whipping it up to the right side of the paper, and really spoke to how she felt like she had no voice, that when she was in active substance use and in this abusive relationship or in any kind of physical, emotional, and verbal abuse, she lost her voice and had no words, and she felt out of control. I encouraged her to do a lot of journaling in between sessions. And so on the left side is a journal entry that she did some artwork around, just kind of this process of treatment and kind of what this felt like for her. So she drew this very long kind of stick figure that represented time. You can see the clock in the chest, and then behind it, these flowers, which really represented the growth that she was experiencing in treatment. She had like red flowy hair. So you can see she kind of drew herself as a self-portrait, kind of laying in the arms of time. So she spoke about how her time in treatment, she was just kind of surrendering to change and letting time sort of hold her as she sort of healed and made progress in treatment. Another really interesting sort of part of her artwork is kind of the cropping of the path that time and she's on. One, it's very slender. So that to me kind of spoke of this process as being very fragile. Like we think about sobriety kind of falling off and there's nothing to hold on to, but also that she's making progress. Like it's kind of cropped in a way where she's come from someplace and she's going someplace. The movement of her strokes really speak to movement and making progress. Right side is the last thing that she made. This was a box that opened up. Containers in art therapy are super helpful in terms of creating like a physical boundary for keeping something safe. So obviously the images she included were peace and love and rainbows and hope and night and day. And inside she kept all these quotes that people gave to her throughout her time in treatment that were really meaningful for her. A second trauma client is a 24-year-old Caucasian male that I worked with seeking treatment for drug addiction, severe depression, and very low self-esteem. He had a childhood physical abuse history, also engaged in a lot of crime connected to drug abuse, and very chaotic family dynamics. His father at the time was an active alcoholic, and he was still living with him at certain points in his active addiction. So this client painted houses for a living, so also that kind of artist piece to it. And this is a great example of typically just a different kind of therapist-client dynamic, because I really took the opportunity, especially with him working towards building self-esteem, for him to teach me something. And so he came in with this very interesting painting process that he liked to perfect. And he would basically take maybe 15 different colors, and he would put each of them in a different cup and thin them out with water, and then pour all the different colors into one cup and layer them. And then he would dump them on top of a canvas or any kind of object and like roll the paint around to create these really interesting, like tie-dye swirled surfaces. And you can see in the different, he did it over a mask. The very last thing that he made, he took rocks and flowers from the river outside, which is a really significant place at this treatment facility, and then dumped paint on top of it and rolled it around. So what's very interesting, also the little box that you notice on the top was a box to keep his 90-day sobriety chip, which is really meaningful for him. And then he did a painting on top of it. And what's really cool about this is when we talk about the art therapy process and how it can mirror the healing process, this is a great example of that. From my perspective, he was taking something very chaotic, something very natural, something kind of out of his control. Every time he, put different paints and layered them and poured them on top of each other, nothing was ever exactly the same. And then he sort of very much engaged in pushing and rolling and trying to almost control this chaos, right? And so when I think about someone who's growing up in an environment of physical abuse, emotional abuse, verbal abuse, especially as a child, you don't really have that control. So I saw his process as we would sort of talk about his experiences while he was making this art, very much mirrored his childhood and sort of, trying to control the chaos, which was a complete reflection of the artwork that he was making. And lastly, this is a over 50 female that I worked with seeking treatment for drug addiction, depression, and low self-esteem. And she was processing grief connected to an abortion that she experienced in her teenage years and motherhood in general. So she loved to remind me that she was not artistic. Every time she came in to meet with me, she would talk about how she's not good at art, how she is just really bad at art, and sort of this very much like self-deprecating sense to her. So I was more than happy to kind of help her with her process. I'd say, like, what would you like to make and how can I help you? So I'm definitely, of course we want our clients to definitely make their own art, but if they need help or they want assistance, that's definitely our job. So she chose to make a pillowcase, which I thought was really interesting too in terms of her healing process. When you think about abortion or a medical procedure, a lot of that is care and comfort and recovery in a bed with pillows. And so it was interesting that she kind of chose to make this pillow. So she kind of put in different personal elements to it. The very middle is almost this like family crest. She had 2 older daughters who were in their teenage years. One of them was a musician, so she put a music note. And she did a self symbol, which was a panda. I thought that was quite interesting. When we think about addiction, that can often be a lot of exploration around black and white thinking. And when you think about a panda being black and white, I thought it was just, again, kind of interesting that that was her self symbol. And then towards the end of our treatment together, if you notice on the very top, she brought in this blue, pink, and yellow baby blanket that she had knitted herself. And she brought in a little toy baby. And so we started to kind of process the abortion, and she decided to create a little inside pocket of her pillow to keep the baby and a little piece of blanket on the inside. She had never disclosed the abortion to anyone but myself and her mother. And so it was very healing and just a really awesome part of our treatment for her to kind of on her own bring in this element of wanting to include that trauma piece in the pillow in a very secretive way that only she knew she had kind of processed. So it's pretty special. So I do want to highlight too, just the last of the trauma work that I'm going to show you. There's an amazing article written about 5 years ago by National Geographic. There is a program at NICO, the National Intrepid Center up in Washington, D.C. It is a 1-week art therapy program for active military soldiers to process their experience. And it kind of culminates in a mask making project. And National Geographic did an incredible article about some of the people who participated in the program and their families and how it was helpful for them. And these are some of the images of their masks and their artwork. So the link is up here. I definitely encourage you to check it out. And it's just a very, very good example, again, of more artwork connected to trauma and what that can look like. So just wanted to highlight that for everybody. So now I'm going to show you a bunch of different group and individual art therapy from just different settings that I worked with. Some of them, most of them are kind of those structured art therapy interventions. So I'm just going to kind of go through and show you what some of those can look like, because they can look very different. So we talked about this mandala check-in. Wanted to show you a few other examples of what people made. This was also substance abuse, adult substance abuse inpatient clinic. One of these at the very top left, this was a person who was heading towards very close to their discharge date. And so he drew a hand holding a Frisbee that said relapse, 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 relapse. And he sort of talked about as the days leading up to his discharge come up, he finds that he just keeps thinking and spiraling around. Am I going to relapse when I leave here? Is this going to work? Am I going to be coming back here? So almost like if you took a Frisbee and just spun it, those are the thoughts and racing thoughts that he was having about relapse. On the bottom, this person didn't want to use a circle, so they flipped it over and just drew a big black line across their page, which was their emotional baseline. And then all the different colors and lines behind it were their different feelings from that day. So all, coming in and out of the page overlapped, many, many different emotions coming through. And this was the very beginning of his treatment process. Someone else kind of divided their circle up into a peace sign. They put in hope, respect, and self-forgiveness. And it was a sun, so kind of spoke to growth and the happiness that they were feeling. This is a bridge drawing intervention. So bridge drawing intervention is a great way for art therapists to sort of explore where a client's been, where they are today, and where they want to go. So a very kind of past, present, and future orientation exploration through artwork. So what I'll ask is I'll hand out blank pieces of paper, and I'll ask clients to draw a bridge from some place to some place. It can be from a real place to an imaginary place, from some place you've been to some place that you want to go. And then 5 minutes before completing the drawing, I'll ask them to place themselves somewhere on their bridge and as a small little dot, or it can be a self symbol, and then a little arrow in terms of where they might be headed, which direction they might be going. So here's one example. This example to me is very straightforward. Use of very restrictive materials. She's using maybe a little bit of crayon, but mostly colored pencil. On the left side, you can see this client is moving from negativity, depression, self-pity, loneliness, and insecurities, and lies to acceptance, self-love, positivity. You see family with open arms and love, her NA community, and then she's moving from pessimism to optimism. Her bridge has something to hold on to. It's definitely made up of kind of these like different planks or spaces, and perhaps that speaks to the 12 steps or kind of the different steps in recovery. If she falls off the bridge, she has this network of people who are there in a boat ready to come save her. And so this was her kind of interpretation of where she's been. She has the kind of broken heart, and kind of you can notice kind of she did a self-portrait. Her face is definitely not smiling. It's kind of weary, and she's kind of headed into that middle portion of treatment. So this is a great way for us to kind of go through each different part of this with the client and sort of speak about where they've been before, what their goals are, and where they want to go. Exact same prompt, but very different style of drawing. So this client, I can't remember if she was in the same group, but she chose to use oil pastels, which are very different, more blendy and more not as restrictive as the drawing before. So this client spoke to how, in her experience with recovery, she has lost a lot of friends and experienced a lot of death and overdose connected to drugs. And this is what that looked like for her. So what I find interesting about this artwork is it's very, very hazy. It's definitely very disturbing, kind of that graveyard, lots of bones, and it's kind of hard to make out. Her bridge is very slanted, right? So it goes from being very low to being very high. And when we think about the recovery process, it's kind of like an uphill battle. It's very difficult. And you'll notice in the right corner, kind of up top and down below, she does have a sun and a little bit of blue sky and some green, some growth. But ultimately, the majority of her picture is black and white and not a lot of color. And what that kind of says to me as an art therapist is it kind of makes sense, right? You know, when you've been in active addiction for so long and not in recovery very long, what's going to be familiar, what's easiest to draw is going to be active addiction, right? That like the expectation is not for her to really know what recovery even looks like. So for her to even include a little bit of color or just a little bit of a sun is pretty awesome. And so we can kind of use that as a tool for encouragement through her process. Same prompt, a little bit different. This client talked about what it feels like to kind of feel right in the middle of the struggle. He's trying to kind of, on the left side, you can see that chain breaking free from fire and pain and kind of this devil angel metaphor that he was working with. And so he felt just very much suspended and unsure, is this going to work? Where am I going? Kind of feeling very much in the middle, and kind of this, again, like angel devil piece around substance use and what his drug addiction looks like. And lastly, this is the same prompt again. This is a bridge drawing. This was with a younger girl. She was 13 that I worked with actually in home art therapy. She had sickle cell anemia, so she was not able to kind of live a very normalized childhood with friends and going outside for safety reasons. So she was homeschooled and spent a lot of time inside. Her bridge has, if you notice on the very bottom, these jet packs that she could fire up, and her bridge could take her anywhere in the world that she wanted to go. Also very interesting in her artwork is her like sky, whereas typically maybe it'd be clouds and earth, was outer space. And so she was really thinking like macro, outside the box, just wanting to kind of travel and leave the four walls that she was inside so much. So I thought this artwork was so interesting as someone who is stuck inside, wanting to be taken anywhere at any moment, anywhere in the world, even to outer space. If you do notice though, her bridge is colorless. She did draw herself on the bridge alone, like no one else is on the bridge. And so it's very interesting that perhaps that kind of speaks to isolation and what it might feel like for her to not be in contact with many people. So body scan, this is something that I use a lot. So I'll kind of give out this piece of paper that's just kind of a general body, and I'll say, draw what anxiety looks like in your body. I offer the pre-made scan, and then I'll also offer plain drawing paper because I like to give clients lots of options. For the client on the left, this was his anxiety. It was like hot, and it almost is like blurry vision. When he becomes so anxious, it's kind of like an out-of-body experience. He does not feel in his skin. On the right side, this client said when he feels anxious, it's like he's so in his head. So he just blew up his head and put it basically like, so that's what the entire picture is on top of the whole body scan. Someone kind of described it as like their head being in a vice and all these eyes looking at him, making him feel like a lot of social anxiety and like a fire in his chest. These are a couple paintings or drawings around anxiety, so not the body scan, and kind of seeing what people come up with. The person on the left, it's like, feels like their head just is going to explode and kind of their body and their stomach are in knots. On the right side, that social anxiety piece, lots of mouths just kind of laughing. And, you know, I think this really evokes, I can hear from this artwork like a ha, 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 ha. It's kind of written and kind of poking our eyes out from underneath our hands. It's interesting. This is an intervention I do called 5 Gifts, which is really great for the imagination. I offer clients to think about what are 5 gifts if they had an unlimited bank account that they might give to 5 different people in their life. And then I also offer to create 1 gift for yourself. It can be a material gift, but I also offer like maybe emotional gifts, gifts that don't necessarily cost money, such as quality time, love, and it's interesting to see kind of what different people come up with. So for this client, she created the gift of love. She wanted trust back with her family, gratitude, the gift of gratitude for her mom. She'd been really supportive in her process, and transparency. So the idea of like a window, kind of speaking to wanting to be really transparent about her struggle with addiction. So the different one, this person used collage. He wanted to get healthy. He wanted money. He wanted to give his mom on the bottom right side, that's his sobriety date, so his sobriety. And so just again, another example of how this can look very different. Something I do with clients that I love doing is called a mood mandala, where we sort of take your whole day and have you write all the different feelings that you might feel in a typical day. Then choose 4 or 5 of them that you feel most often, pair a color with that feeling, and then go into a pre-made mandala and color it in based on how frequently you feel those feelings. Grounding bracelets is something that I make with clients. We talk a little bit about grounding and how to use our senses as a way to feel calm and relaxed. So we use these little things called crater beads, and we make bracelets, and then we tap essential oil on the crater beads. That way, if they're feeling anxious, they can kind of have a really calming smell that's very easy for them to just wear around their bracelet, wear around their wrist and have if they sort of need that smell to use as a grounding tool. Self-care, I don't know if you've ever seen one of those like at a coffee shop. Take one if it's a babysitter or a house cleaner. Like I take 1, 2, or 3 for self-care. So what I have clients do is come up with 8 different self-care tabs that they might need and have it somewhere really accessible. I say, like, put it in your bathroom, put it on your fridge, and pull a tab when you need it. So it can be disconnecting from social media, make a hot cup of coffee, go for a drive, call a friend. This is kind of like self-care tabs that you can kind of rip off as you need them. A really simple one I can do sometimes is take a piece of paper, fold it in half, and have clients draw an image of how I feel today versus how I want to feel tomorrow. And this is artwork done in an inpatient psychiatric setting. This man did a self-portrait and said, I feel uncertain about what the future holds for me because I've always been misunderstood. I don't know how I will feel tomorrow because tomorrow is not promised to anyone. Draw yourself as a tree. A tree is a great metaphor for working with clients in terms of kind of shedding skin and progress and healing. On the left side, this girl drew a tree of what she started before treatment and how she felt. If you notice the trees, in her tree on the left side, it's the stalk or the trunk is very thin. It's not really grounded to anything. There are no roots, no color, kind of this gray background and fallen leaves. The right side represents how she felt when she left treatment, this really thick, grounded tree, lots of roots spreading out on the bottom, lots of growth, obviously, with the colors and the flowers and the leaves. This is an example of me making art with a client. Sometimes that's really helpful. This is crayon and watercolor. So crayon is an oil and watercolor is a resist. So what we do is have you do a really crazy crayon drawing where you go off the page and you can close your eyes, get really crazy, and then go in with watercolor and kind of make a really beautiful stained glass window. this is an example of some artwork from a child that I worked with who was processing grief, very young. So it was ages 2 to 4. I used to work in it's like a nonprofit for children who had lost a sibling or a primary parent. So for this group, all I did was draw 4 circles and have them draw what the 4 basic emotions look like. So happy, sad, scared, and mad. This child was a really good artist. I think he was a little bit older. He might have been 7 or 8. And he added his own middle feeling, which was swagger. And this really cool kind of like cat cartoons for each emotion, which I thought was really interesting. Another one I do is what you want to leave behind versus what you want to take with you. So I sort of present each client with a kind of head motif, and then I fold a small crease just between the back of the head and the very front of the head, and ask them to, in a perfect world, if you could leave behind all the trauma, bad habits, negativity, anything in a perfect world, if you want to leave it behind, what might you leave? And then just the very front of the face, anything that you want to take with you, even if it's just one thing, what might you want to keep with you? At the very end of the session, I offer that if they actually want to rip off the back and throw it in the trash can on their way out to kind of simulate letting go, and then maybe fold up that very front part of the paper, if it's something they want to hold on to, they can keep it in their pocket or their wallet. But this is a really good kind of simulation exercise for what I want to let go of and something that I might want to keep. Same intervention, but how this person interpreted was a little bit different. What I really liked about this is on the bottom, you notice this person's self-portrait is someone hunched over. The mirror is themselves kind of cracked and really upset and sad with themselves. You notice he puts in there wanting to let go of addiction, belittling himself, not being able to forgive himself, anger, shame, and guilt. And then in the very front of the head, he draws himself erect, like really proud of himself. In the mirror, he's smiling, and he wants to take forgiveness, trust, being drug-free, and confidence with him. And he kind of drew the whole world with an eye open. So wanting to be more open to the world and all the possibilities with it. And lastly, I think this is the last one I included in here. This is a directive that I do. What do you hold in your heart? What do you want to pump out? And what do you want to let in to breathe easy? So kind of working with the metaphor of a heart. Very different interpretations of this. One person on the left drew a really awesome self-portrait of their grandmother, like very realistic and lifelike. They had just passed and they're very important to her, so she keeps her very close to her heart. On the right side, this client really loved working with words. So sort of kind of put all these different words pumping out, coming in, things she wanted to keep and let go of. And so that was a very different and interesting interpretation of, again, the same kind of art therapy intervention. So Kendra, that's the majority of my kind of art therapy presentation. I do want to talk a little bit about, we've talked about maybe having some virtual small groups to kind of offer support to people at this time. So I'll kind of give it back to you, and then I can talk a little bit about what those small groups might look like.
Yeah. And so I think I'm going to go ahead and allow people to unmute themselves if they have questions. But I guess I really want to ask you is, particularly in this time where people are feeling isolated and uncertain about the future, you had mentioned these wonderful activities or prompts basically to get people thinking, but when do you think it's a good idea to reach out to someone like you?
Yeah, so that's a really, really great question. So as I speak to sort of, the beauty of being an art therapist is it just makes me a more dynamic therapist, meaning I am just a regular therapist that is able to kind of use art therapy as a tool if it's helpful. So more the answer is sort of, at what point does it feel like working with a therapist or having a little bit extra support might be helpful? Now, I always say that, when you think about, some people ask me like, do you think everyone should see a therapist, or, kind of what that looks like? And obviously I'm biased, or I sort of say, the idea of talking to someone about yourself, or just sort of giving yourself 50 minutes a week to express or talk about anything that you want, to me doesn't seem like it might hurt, right? Or like a bad idea. So I encourage it for all people who just, again, it can be stress related, especially as we speak to everything going on with the virus and how different this is right now. I will say though that, typically I get clients that come in wanting CPR, right? Like we get to that point where we're either the volcano's exploding or we want immediate help or an immediate fix right this second. And ideally, therapy should be what I call a tune-up, right? That like we want to like check under the wheels, rotate the tires, make sure everything's working properly, rather than coming in with this like immediate need of a fix for help. So I would just say, you know, one, I think, especially everything going on right now, this is a very different time. This is a very stressful time. This is all new. And anytime we're in kind of uncharted territory or something new, it can feel really helpful to have some extra support with that. Everyone as human beings, I think, asking for help, needing support is necessary. We're not wired to do anything alone. So I definitely encourage, you know, again, as we have this climate, it's very much new territory. It's very stressful territory, lots of change very quickly. I feel like now could be a great time to kind of have that extra support. I don't think that it would hurt, if that's just kind of my perspective.
Yeah. Yeah. And I think, I don't know if you want to go ahead and kind of walk us through what some of the small groups could look like. And, you know, maybe talk about the difference between an individual session versus a group session and how that might.
Totally. Yes. So I know I have the slide up right now that says goals for virtual kind of small groups. But I want to definitely give the caveat that this could change kind of based on need and what's helpful. So I'm definitely mindful that the art therapy portion could shift and change as well. Definitely providing art therapy virtually is very different for me, and that definitely poses its challenges. For example, I am used to providing you with the art materials that you need, whereas in these group settings, I can't provide all the art materials for every single person. So it would definitely require a little bit more from the participants, or sort of, you know, using more basic materials that you might have just kind of in your house, even if it's just pen and paper. So the art making piece, well, definitely is kind of subject to change, but it would probably be more people, I would give a prompt, whether it's kind of sending those body scans or those check-ins, I would go ahead and send that, and then have, along with a art intervention that you can do, and then probably have people do them on their own between meeting of the group. So then we would come together as a group and process the artwork, if kind of process what your experience was like, how it was helpful for you, to definitely create, mainly with the groups, a sense of community, and just sort of definitely focusing on coping skills to kind of manage stress and change, and how the virus is definitely affecting everyone at this time, but also using it as a time to process the artwork that will be probably given outside of the group itself.
Yeah, I think that sounds great. So I'm going to go ahead and, does anybody have any questions?
I have a question. Thanks for this presentation, Meg. I noticed that masks were being utilized with several of the patients, and I was wondering, do you consider this method as successful? Is it a successful method for self-reflection? If so, how is that?
Yeah, sorry, Sheena, I think I missed the first part of what you said, and I think that's...
I noticed that the masks were being utilized by several of the patients, so I was wondering if, you know, this method is considered successful with self-reflection, and if so, how is that?
Yes, a great question. So yes, masks are used a lot in art therapy, basically to kind of explore the metaphor of inside versus outside. So when we think about kind of the persona that we put on the outside versus how we're actually feeling on the inside, sometimes there can be a huge change or incongruence between outside versus inside. So, you know, to the point of which you think a lot of people who struggle with anxiety, for example, inside they are just worried and overwhelmed with fear, but on the outside they might do a really good job of like remaining calm and sort of not expressing how they might be feeling on the inside. So the mask as a metaphor is a really great way to kind of process how I'm feeling on the inside versus the persona that I might put on the outside. And the goal in treatment is typically to make sure, or to work towards, both of those being the same.
Yeah, so are there any other questions? Brittany, you can go ahead and unmute yourself too, and maybe add a few comments.
I actually have a question. My name is Kim. So if we did the small group, would we be able to, or are you looking for us to maybe send you a picture of our artwork prior to the group, or not?
Yeah, Kim, that's a really, really good question. So again, definitely something that I'd probably have to take into consideration in terms of like what would be helpful. I definitely think sending a picture of your artwork beforehand would be really helpful. Definitely virtually being able to hold up your artwork just like live in the session would definitely also work as well. And then you can kind of take us through the artwork. As an art therapist, any imagery that I can get that you send me ahead of time that gives me a better understanding of what things look like is definitely going to be helpful. So I definitely think that would be helpful. So my answer is potentially both, like sending your image to me ahead of time just so I have a really good idea about what it looks like, but then also offering for you to probably hold it up or virtually show us what it looks like.
Okay, thanks.
Mm-hmm.
Any other questions? I was wondering, as far as the group dynamics, how big should the groups be? Do you have any suggestions on what the group should actually consist of as far as types of people? So I know there's, like, particularly in this setting, there's going to either be, you know, student groups or potentially professional groups that get together to do one. Is that okay? Yeah.
Yes, that's a great question, Kendra. So definitely one of the barriers to groups can be, or one of the ones that I come across the most is time. So figuring out a time that every single person can meet, and obviously being very mindful that in this setting as well, everyone, you know, works a lot for very different hours. So I don't know if it would be most helpful to kind of group people based on time, or group people like what's accessible for people, or, you know, obviously basing it grouped on profession or graduate students or kind of that. So what I'd like to do is first just kind of see what the interest looks like. And then if it's kind of possible to group them in that way, I think that would be ideal. But it may just have to be a little bit more open because it might be hard to kind of coordinate the time piece. So to be determined a little bit. But honestly, we're going to be processing so many of like basically similar themes. So it really shouldn't matter too much around based by profession or kind of what you're doing.
All right. Is there any other questions? No? Well, first of all, I want to give a big thank you to Meg, but first I need to make sure that I mention the Wandry and the Communication of Science and Technology program for sponsoring this. And I'm just going to go ahead and unmute everyone, and we can just give Meg a round of applause.
Awesome.
Yay.
This last slide also is my information. So feel free to reach out to me with any questions that you have from the presentation, or if anything I can elaborate on, or questions that you might have after. I am happy to answer them for you. So thank you so much.
Thank you.
All right.